Neil's obviously given some fabulous background information to lymphatics and shown some very high resolution images of what happens within that cell level. But what we're talking about from my presentation today is more with regards to lymphedema management. And obviously the aim of any of our management is to prevent progression of the condition, to reduce any existing swelling, maintain that improvement, reduce symptoms, because there might be other symptoms of heaviness or soreness, preventing infection, he made multiple references to skin health, and just overall improving your function and quality of life. So as I'm sure all of you are aware, there are many risk factors that can lead to your risk of developing lymphedema. And I think that's one of the most important things to keep referring to. It is your risk. It is not a guarantee. A majority of people don't develop lymphedema. So as much as we want the awareness to be out there, I think we need to temper it also. We don't want to be scaring people as well, so that's important. So obviously the more extensive the surgery is, the higher someone's risk would be. The higher number of lymph nodes that have been removed, obviously, again, the higher their risk. Whether or not they've had radiation treatment, and that's becoming more common. And then also, as Neil was talking about, your weight or your body mass index. And as you can see there in the brackets, depending on how high your body mass index is, significantly impacts your percentage risk of developing lymphedema. Whether or not there's been complications following surgery, and also if you've had Taxol chemotherapy. So there are a lot of different factors that make up the individual's risk that we would speak to you during a consultation. One of the main things that we try to do at St John's with our lymphedema program is using the current technology, and Neil made reference to bioimpedance spectroscopy. So we're really fortunate that we have a SOZO machine, and there's also one over at the Cancer Centre as well. And this is endorsed as being best practice for early identification of lymphedema. We're also trying to extend that out to the other risk cancers that are relevant for lymphedema as well, not just the breast cancer population. So what does this involve? So it's a program called prospective surveillance. So the idea is that we would baseline measure someone pre-intervention. Ideally, that would be potentially pre-chemotherapy. Usually it is pre-surgery, and sometimes it is pre-radiation. So basically, we prefer to get to patients before anything happens, but we'll take you anywhere along the way at any stage. So for example, if we go to the right-hand side, your left-hand side of the screen, and there you can see on the bar graph there's the number 2.3. So if we take, for example, that was somebody's pre-operative value, and then they come back to see us and they're now down to 16.3 and they're in the red zone, we know that that's statistically significant increase in their swelling, and as a therapist, we need to act. The really fantastic thing about the research that was the PREVENT trial that Australia had a couple sites, it was a big international study, was of these patients who have got baseline data, who then come back and they've triggered an intervention, 92% of them did not progress to chronic lymphedema. That is massive. 92% of people with clinical signs after they were intervened in the study did not progress. So making contact with us early, keeping in touch with us, continuing to be monitored is so critical, which can be a little bit bittersweet talking to a population like yourselves in the room today, and you might already be past this point. But if you can share for the benefit of others, and then also know that we can still support you in many ways, even if you do have established lymphedema. So ideally, the picture to your right would be showing that we've got some baseline measures, then somebody's peaked up into the red zone, we've intervened, and now they've gone back into the green and stabilised. That is what we wish for anyone. We also still use the tape measure. We obviously need to use that if we're measuring for compression garments, but if we are only using that to measure swelling, if somebody is putting on or losing weight, fat or muscle mass or fluid, the tape measure changes. So that's why we like the combination of the technology as well. So the management that we choose to deliver at St John's is complex lymphedema therapy, which is known as best practice. It involves a lot of education. So we go into, not as deep as Neil did in the previous presentation, but we do go into a lot about how the lymphatic system works. Personally, I don't call it a sewer system, I call it a drainage system. It's just a little bit nicer, but that's okay. Then we also talk a lot about skin care, and he talked about how important it is to protect the skin. So that's, are you using a good quality moisturiser? So the likes of your QV or your Dermavena, they're the products that we typically recommend. Are you an avid gardener? Do you wear long sleeves? Are you wearing gardening gloves? Are you inspecting your skin after being outside? No spider bites, no cuts from the roses. Are you using sunscreen? Are you using insect repellent? They're the simple things that you can do to protect your skin. Exercise. I wouldn't be a self-respecting physio if I didn't endorse exercise, would I? So exercise, and you've heard it again and again and again, it really is critically important for the lymphatic system as well. The manual lymphatic drainage that we do, it's a skin-based massage. It is gentle, it is superficial. Where did we see all the lymphatic vessels that Neil was showing us? In that layer just under the skin. So it's quite soothing. Being potentially a chronic health condition, we're all about teaching people how to massage themselves as well, empowering you to self-care. Then if you notice a difference, you can intervene immediately at that time. Or like some of my lovely patients are going travelling around the world again, they've already got their therapist with them. They know what to do. Compression garments. So that's a really big mainstay of how to manage and help to maintain swelling. I'm getting the hurry up and I'm way behind. Thank you. So exercise, move more. Any exercise is good. We don't care what you do. We don't care where you do. We care that you do. So some is better than none and more is generally better than less. There has been some fabulous research about exercise saying that it may prevent lymphedema, which is huge, and also that it may reduce lymphedema, let alone all the other benefits. So exercise. How to exercise if you've got lymphedema. Listen to your body, monitor your symptoms so that you can make little changes. Like Neil was saying, don't change everything all at once. Change something. How does your body respond to that? And obviously we also have our wonderful South Sea dragons here in Warrnambool, so dragon boating. 150 minutes of exercise, 5 days a week, half an hour walk. It doesn't have to be hard, it does have to be done. Some people might start with 5 minutes. I have one lovely lady that she started off walking 3 times a day, 5 minutes. She can now manage half an hour. So set yourself an achievable goal and build from that. So just to start with again, we'll do a few little exercises so we know to do them slow. So everyone just doing some shoulder rolls, getting things moving. You can just move your hands up nice and high, reaching up. It doesn't have to be hard. Arms out, don't knock out your neighbour. See how you go. And we've started up towards the top of our drainage system. We've cleared around the neck and shoulders, and then we've moved down to the elbows and down to the hands. There's all sorts of other little equipment pieces. So Isabel has some, TheraBands so you can resist the exercise. There's all sorts of different little massage balls that you can use to massage, or you can put them under your arms to squash the lymph nodes. Lots of different options. With the Nordic walking, that's something that can be really good for swelling through the chest wall, so using the walking poles as well. Now this was the main part that we wanted the show and tell, so I've got a few bits here to show. If we had to bandage somebody to reduce their swelling before, it was multiple layers of bandaging that we'd have to do, but now there's a lot of improved technologies. So you would put just one layer of this double-sided bandage on and then overlay with this sort of technology. That can be quite expensive, needing to bandage someone a couple times a week to help reduce their volume of swelling quickly, and that might be prohibitive for someone. So there are also other options that might simply include buying a product that is a wrap garment so that it is adjustable. So that might be something that we could do. They're also fantastic for someone whose swelling fluctuates and it hasn't stabilised. Then we also have a whole different range of compression fabrics. And sometimes somebody buying a garment that fits them now, and then the next garment we get is a size smaller, and we're gradually reducing them over time. That can be an option as well. As you can see, some of the garments even have different texturing at the elbow joint, so that's much more comfortable for prolonged sitting. There's flat knit garments, there's circular knit garments, there's different pressure garments, there's different stiffness of the fabrics. So the garments can be quite overwhelming, and that's where we come in, recommending what we feel is most appropriate for someone. This textured garment is my absolute favourite at the moment. It's brilliant for all of our palliative patients or any nursing home patients, and it's also a fabulous nighttime sleeping garment. So there's always new products. These have only been on the market for the last couple of years, so they're always developing something new. We can access funding through your private health insurance, NDIS, TAC, DVA, work cover, and as accredited practitioners, we can also access funding for garments through the statewide equipment program to help with affordability. Other treatments, that's a photo of our beautiful hydrotherapy pool at St John's. We have a laser unit. Neil referred to laser for fibrotic tissue treatments. And we also have compression pumps, air pumps, and we've got each of the devices pictured there. So that's more of a mechanical massage that can be really beneficial for patients. There's no surgical options locally, but there are surgeries that can be done, and that might be something that we could recommend referring you to potential support there. And currently there are no medications that can help manage your lymphedema, unfortunately. So there are 3 physios that are accredited lymphedema practitioners at St John's. We do accept referrals from the GP under the Enhanced Primary Care Program. There is a gap fee. People can self-refer via private practice appointments or use their extras cover. We do offer a quarterly support group, and we're linked in with the Lymphoedema Association of Australia. We're currently the only Victorian site that's linked in there. And we also have our hydrotherapy compression pump and the bioimpedance spectroscopy. So all of those can be accessed. So I'd really recommend, if you want more information, to go to the Australasian Lymphology Association website. We've got a flyer on Isabel's table down there that has this website on the bottom. And they've even got a video on how you can self-massage. So it's all about promoting self-care. And there's also some flyers down there from the ALA with regards to being important factors for lymphedema awareness.